Let's discuss the most effective nutrients for removing plaques from the arteries. When I mention plaques, I'm referring to the combination of cholesterol, a specific type of protein that causes fibrosis, and calcium. These three elements come together to form a sort of bandage when there's inflammation or issues with soft plaque within your arteries. A crucial piece of information is the distinction between two types of arterial plaque, soft plaque and hard plaque, also known as calcified plaque. They have quite distinct characteristics. Soft plaque is unstable and more dangerous than hard plaque, which is denser and more stable, hence less risky. Soft plaque is 4 times more common than calcified plaque. When you undergo a coronary artery calcium (CAC) test, you receive a score that primarily reflects the amount of calcified plaque in your arteries, as soft plaque often transforms into this type of plaque, something that is not detected in the CAC score. Now, there's something called the CAC paradox, where you may notice that your CAC score increases after making changes to your diet, eliminating bad habits, and adopting a healthier lifestyle. This increase doesn't indicate worsening. In fact, it means that more of the soft plaque is transforming into hard plaque, making it more stable. Additionally, glycation is related to this type of plaque, where sugar molecules bind to proteins, causing inflammation in the body. This soft plaque is also linked to increased oxidation processes in the body. All right, let's address the topic of LDL, HDL, and triglycerides. I'm not talking about LDL in a generic way. I'm specifically referring to the most harmful type. There are 2 types of LDL: small, dense LDL, which is more compact and dangerous, and large, buoyant LDL, which poses less risk to health. It's crucial to understand these distinctions. To identify which type of LDL you have, you can use 2 biological markers present in blood tests: myeloperoxidase and Lp(PLA2). These markers help detect the presence of soft plaques in the arteries, which is a serious concern. Additionally, an ultrasound of the carotid artery can provide valuable information with 98.6% accuracy in identifying issues. Keep triglyceride levels lower, as high triglyceride levels often indicate excessive carbohydrate consumption. All right, let's discuss how to identify which type of LDL you have. Let's talk about how you can find out if you have the small, dense particles in your LDL or the large, buoyant ones. This can be done without the need for a specific test. One way to do this is by dividing your LDL by something called ApoB, which is part of the lipoprotein and indicates the number of particles. Ideally, this ratio should be greater than 1.2, which would indicate the presence of large, buoyant LDL, the non-pathogenic version. Now let's talk about which nutrients can assist in removing plaque from the arteries. The first nutrient is pycnogenol, derived from pine bark. A dose of 150 milligrams is recommended to convert soft plaque into calcified plaque, making it more stable and preventing its formation. Another option is gotu-kola, with a dose of 450 milligrams. It enhances the action of pycnogenol, facilitating the conversion to a more stable plaque and also preventing its formation. A third effective nutrient is vitamin K2, known for significantly inhibiting vascular calcification. It's important to take vitamin K2 in milligrams, not micrograms, for the best results. In addition to these, there are other beneficial nutrients. Niacin is important, especially the version that causes redness, as it's more effective against cholesterol. It's also worth considering tocotrienol, berberine, aged garlic, magnesium, and potassium, all useful for softening the arteries and reducing inflammation. Let's not forget about vitamin D, which has anti-inflammatory properties and is effective in preventing plaque formation in the arteries.